Welcome, my name is Dr. Janna Bentley and I am the Medical Director of Lakeshore Vein and Aesthetics Clinic. I've been practicing aesthetic medicine and phlebology since I graduated in 2005. I'm going to walk you through the entire VenaSeal procedure from beginning to end, and feel free to pause the video at any time, rewind. You can fast forward too if you've heard it before. And if after watching this whole video you still have questions, you can either email or call or actually arrange for a re-consultation to discuss your questions and make sure that you feel completely comfortable before proceeding. And on the day of your procedure, again, of course you can ask more questions. We are happy to answer them then as well. On the morning of your procedure, eat a light breakfast and take your regularly scheduled medications. There aren't any that you need to stop beforehand. Once you get here, our team will meet you and we will bring you into your room. So the VenaSeal procedure takes 60 to 90 minutes. Most people are happily surprised at how smoothly and quickly it goes. Prior to your VenaSeal procedure, a nurse will give you a gown, a housecoat, a bonnet, and some booties to put on. Once you've put on those things, we will get you situated on the bed with a blanket just to keep you warm before your procedure. A nurse will review your consent form for both VenaSeal and possibly sclerotherapy, depending on if we've planned to do that on that day as well. At the time of signing your consent, our nurse will review whether you have any allergies or if there's been any changes to your health. Your blood pressure, your pulse, and your oxygen saturation will also be taken. And we will, again, review any questions that you might have. If you're feeling rather anxious before your procedure, we do have Ativan. If you choose to take this medication, we need you to get someone to give you a ride home because we don't want you operating heavy machinery or a car for 12 hours after your procedure. Just before getting into the surgical suite, we recommend you use the washroom. And then we will walk you down the hall to our surgical suite, where you will be asked to stand on a sterile blue pad. The nurse or assistant will take your housecoat from you. Your blue booties will also be removed. It's a sterile or clean environment, so we ask you just not to touch anything else and keep your hands at your sides. We're going to ask you to hold your gown at waist height, and you'll be cleaned all the way along your legs. Once your legs have been cleaned, our assistant will position you on the bed, either on your back with your legs fanned open or on your tummy, depending on the vein we're accessing. If you're positioned on your back with your legs fanned open, we will have you turn onto your side. We have pillows to prop and hold you up. We will make sure that you're comfortable, so if there's anything that you need us to do to adjust your position, we will do that for you, so that you're comfortable for the entire 60 to 90 minutes during the procedure. After that, our lead nurse will enter the room. She will have scrubbed and she will gown up. And then we'll drape you with sterile drapes, so we'll ask you to either keep your hands on your chest or you can have them up behind your head. They won't have to stay up there for long, but just so that we can keep the field as clean, as sterile as possible. Once you're positioned, the drapes are in the right places. Ultrasound gel will be applied to your leg. It is a bit cold, sorry about that. Your physician will join you at this time. Using the ultrasound probe, your physician will check the position of your veins. Then a small amount of local anesthetic will be used in order to access the vein as painlessly as possible. So you will feel a small prick at that point. Once access has been gained and the catheter is in the vein, then we're going to start actually gluing the vein closed. And this is probably a bit boring for you at this point because all you're doing is waiting as we systematically pull the glue tubing out and deposit small aliquots of the cyanoacrylate into the vein and apply pressure. The longest time for pressure being held is at the very top, where we hold it for 3 minutes. After that, each section every 3 centimeters is about 30 seconds of pressure on the vein to make sure those vein walls are totally in contact with the cyanoacrylate glue. As we're pulling the glue tubing out, you won't feel much, although there are some spots where if your vein is a little superficial, and we'll try to warn you of this if we anticipate it, you might feel some tugging. But the vast majority of people find this procedure goes very quickly and they are happily relieved at how easy it was. So once we are finished gluing the vein closed, we actually resheath the glue tubing just to make sure that there's no drops of glue under the skin. And then all we need to do is apply a steri-strip. There's no stitches needed. The entry site is this big, and you'll have a dressing placed over it. Right after the treatment, you may feel little to no difference. You may notice that your leg doesn't feel as heavy, but you'll probably notice it's a little bit sore from what it's just had done. Immediately after your procedure, we would like you to go for a 30-minute walk, and it's probably good you have someone walking with you just to make sure you're not woozy from having had something done. If you are from out of town and your drive is over an hour and a half, it's a good idea to do calf muscle pumps, pumping your foot up and down on the way home, and maybe get out and walk every hour, hour and a half, even just for 5 minutes. We ask you to leave the steri-strip and the dressing in place for 48 hours. When you do remove your steri-strip and your dressing, it is possible you might notice a bit of blood there, and that's totally normal. After the VenaSeal procedure, it's pretty easy. We want you to be active. It's good to go for a 30-minute walk every day, and we'd rather you not do any prolonged sitting or staying in one position for the first 14 days after the procedure. As far as resuming gym activities, again, go easy, but you can still go to the gym. We'd rather you not do any really heavy bearing down, Valsalva maneuvers where you're really putting pressure on your tummy, like heavy weightlifting, but most gym activity is fine. After your VenaSeal procedure, it is normal to have bruising, but it's also very normal not to have bruising. So don't be concerned if you have bruising or if you don't have bruising. It will go away. After your procedure, we do want you to take ibuprofen or Tylenol or acetaminophen if you can't take ibuprofen regularly every 4 to 6 hours, as the bottle says, for up to 5 to 7 days. You may notice you don't really need it for a while, and then maybe a week later you need it again, and that is very normal. And you can also pick up some topical anti-inflammatory like Voltaren or diclofenac gel to put along the vein, just to keep the inflammation down. Approximately 2 weeks after your procedure, you may start to feel a tight feeling like a pulled muscle, and that's very normal as the vein is starting to shrink. And it's at this point that you might feel the need again to take ibuprofen or acetaminophen, even if you'd had a week of not needing it. The evening of your procedure, your physician will call you just to touch base. And if you have any questions, you can again ask them then. You're also free to text the physician and ask questions that way. Your first follow-up will be around 3 days, but that is flexible. Usually your second follow-up is around 7 to 10 days, and usually your third follow-up is about 2 months out. At those follow-up appointments, we are checking for any complications, which are unlikely, and at that time also including some of the side branch sclerotherapy, which we include at each session in your 3 follow-ups. On your follow-up sheets, you'll notice that you have your physician's cell phone number. You can use that at any time. If you're concerned about anything, we would much rather hear from you than have you go to a walk-in or to the emergency department, because we know what is normal and what is to be expected after this procedure. With the VenaSeal procedure, it is amazing, but there is no vein procedure out there that cures a person of their tendency towards varicose veins. And so it is vitally important, if you want to maintain your legs, to come yearly and be checked. Some years you won't need any maintenance, but other years you will need sclerotherapy, the injections, to maintain your beautiful result. You should have symptom results in the first few weeks, so tired, heavy, aching legs, cramping at night, restless legs, all of those things should improve in the first few weeks. One of the things that takes the longest to improve is swelling. That can take up to a year to improve because swelling takes a long time to develop, and so it does take a long time to get better. As far as the visual improvement goes, even at a week it will start looking better, but you may have some bruising which takes 10 to 14 days to go. As far as the bigger bulges go, you will notice probably at 2 months after your procedure a large improvement, but true before and after pictures are 6, even 12 months later. If any of this information has been unclear, please write it down, please call us or drop in, send us an email, and we'd be happy to get back to you so that you feel completely confident proceeding with this. Otherwise, our team looks forward to seeing you.